Have you ever walked out of the store and had no idea where you left the car, then thought, is this just aging or is something more serious? That question matters more than ever. Today, many older adults take several prescriptions each day, sometimes 5 or more. And in some reports, nearly 1 in 4 seniors are prescribed 10 or more drug classes. That much medicine can sometimes puzzle more than just the pill box. In this video, you'll learn how to separate normal aging from substance-related memory problems and see practical steps to protect your brain health. Why so many pills, so many problems? So why do so many older adults find themselves on long medication lists? And why can that become a problem? The answer lies in polypharmacy, taking multiple drugs at the same time. Seniors often see several specialists, each focused on treating one area: a cardiologist for the heart, a rheumatologist for the joints, a psychiatrist for mood, a primary doctor tying things together as best they can. Each prescription may be reasonable on its own, but together they can pile up. And sometimes older prescriptions never get removed even after they're no longer necessary. Research shows that many seniors routinely take 5 or more medications, and a significant number take 10 or more. This accumulation increases the chance of drug interactions, confused dosing schedules, and side effects that affect thinking and memory. The body itself also begins to handle medicines differently with age. Studies make it very clear. As people get older, liver and kidney function slow down. These organs are vital for clearing drugs from the body, so when they work at a reduced pace, medicines remain active for longer and at stronger levels. A dose that might sit comfortably with someone in their 30s can cause grogginess, dizziness, or confusion in someone decades older. This isn't a mystery, it's a predictable physiological change, and it explains why even standard treatment routines can start to feel overwhelming for seniors. These two realities, multiple prescriptions and slower clearance, combine to create an environment where cognitive side effects are common. Many clinical reports describe situations where older adults showed dementia-like symptoms that improved once their medication lists were adjusted. In composite cases documented across the literature, simply changing or reducing overlapping drugs often clears the fog. That's why side effects deserve just as much attention as age itself when memory lapses appear. Because of this, doctors and pharmacists encourage practical steps to reduce risk. One well-supported approach is a brown bag review, where a patient brings in every pill bottle they use, prescription, over-the-counter, even supplements, so the healthcare team can see the full picture at once. This process helps to catch unnecessary duplications, spot risky interactions, and simplify medication routines. Families can also help by keeping an up-to-date, written list of every drug being taken and sharing it at appointments. It's a small action, but it can make a big difference in whether symptoms are blamed on age versus adjusted through safer prescribing. Understanding polypharmacy doesn't eliminate the need for careful monitoring, but it does give us one more way to explain why confusion or forgetfulness might appear suddenly. And when you know there's a possible fix, the situation feels less frightening. Still, even with good medication management, memory slips do happen, and not every mistake means something serious. The real challenge is noticing when those slips fit a normal pattern and when they fall outside the usual. Spotting early warning signs without panicking. Memory slips don't all carry the same meaning, and the key is recognizing which ones deserve closer attention without slipping into panic. Spotting early warning signs is really about contrasts, what looks like an ordinary lapse versus what signals that something more concerning may be at play. Take names, for example. Many older adults know the tip of the tongue moment when a familiar name just won't come immediately, but usually it pops back within a few minutes. That's perfectly normal. By contrast, struggling to recognize a longtime neighbor or forgetting who a close family member is goes beyond aging. That's a warning sign worth noticing. Daily routines show similar differences. Forgetting to pick up milk from the store is a common, harmless mistake. But being completely unaware that a shopping trip was ever planned in the first place, or insisting it never happened, points toward trouble with forming or storing memories. Recognizing these shifts doesn't mean assuming the worst. It simply helps families understand when the pattern of forgetfulness suggests something more than distraction. Orientation is another important difference. Ordinary distraction might look like walking into a room and not remembering why you came in, but you still know exactly where you are. More concerning is when someone feels lost in their own living room or suddenly cannot recognize their surroundings. Research shows that sudden changes in attention and orientation are more consistent with delirium, which can be triggered by substances or medications. While not every case is an emergency, this kind of disorientation warrants timely evaluation since it often points to a reversible cause. Because isolated slips don't tell the whole story, the real insight comes from tracking patterns. A simple, practical method is journaling. Just one notebook is enough. Each time confusion comes up, note the date, time, what was happening, along with any medications or alcohol used that day. Over days or weeks, clear patterns often emerge. Maybe forgetfulness always follows use of a sleep aid. Maybe it happens only during stressful family events. These concrete notes create a timeline that both seniors and doctors can work with, transforming scattered worries into actionable evidence. Keeping notes also reduces fear. Without a record, every lapse can feel like proof of decline. Families may panic after a misplaced wallet, assuming it marks the first step of dementia, when in reality it may just be a random slip. But when notes show that lapses consistently occur right after certain medicines, or that they don't repeat at all, the picture changes. Instead of guessing, you have patterns that guide what to do next. It helps to keep the conversation gentle. Instead of telling a parent, "You keep forgetting things," a calmer question might be, "Do you notice certain times when memory is harder?" That kind of framing invites collaboration rather than criticism. And most people respond better when they feel supported instead of judged. Humor also has a place here. Laughing about searching for the TV remote only to find it sitting on the couch cushion is healthy. It keeps worry from taking over. What matters is knowing where to draw the line. Forgetting the remote itself is minor, but forgetting what it's for points to something that needs attention. These observations are less about catching decline and more about collecting useful clues. The brain leaves trails when something is off, and those trails often match up with medication timing, dosages, or interactions. Normal aging usually brings slower recall and more distraction, but it doesn't cause sudden confusion about place or identity. When the signs don't fit the usual pattern, there's often an underlying factor that can be adjusted. With this perspective, seniors and families don't have to panic over every misplaced item or skipped appointment. Most lapses are ordinary and manageable. The practical focus should remain on whether forgetfulness disrupts orientation, changes relationships with familiar people, or consistently follows certain substances. Watching for those signs equips families to step in calmly without jumping to worst-case scenarios. The goal isn't to deny that memory challenges appear with age. It's to respond to them with clarity instead of fear. Tracking symptoms, keeping the tone light, and knowing which warning signs matter turn uncertainty into manageable steps. Often, once patterns are clear, seniors can bring the evidence to a healthcare provider who may find simple medication changes or adjustments make a large difference. And that leads us to the next question many people have. If ordinary medicines can sometimes create these problems, which ones are most likely to cloud memory? The answer may surprise you, especially when you take a closer look at the familiar bottles often sitting on the kitchen counter. The surprising prescription drugs that can cloud memory. When people worry about memory loss, they often think about aging itself. But the reality is that certain prescription drugs are among the strongest contributors to cognitive fog in older adults. Some of the most familiar medications used daily for sleep, allergies, or pain are linked with confusion, forgetfulness, and slower thinking. Research makes this clear. Long-term use of drugs with anticholinergic effects and benzodiazepines has been associated with a higher risk of cognitive decline and dementia symptoms. These are not minor findings. They come from large-scale studies reviewed by neurologists and published in respected journals. Knowing which medication categories to watch is an essential step toward keeping the brain clear. For simplicity, it helps to group these medications into 3 broad buckets. The first includes sedatives, such as benzodiazepines, and a related group known as Z-drugs, prescribed for anxiety or insomnia. While they calm the nervous system, they also blunt alertness and interfere with short-term memory. Many older adults describe feeling groggy the next morning, still under the influence despite a full night's sleep. That haziness often raises concern about dementia when, in fact, it is a medication side effect. The second group includes drugs with anticholinergic effects. These are surprisingly common and include first-generation antihistamines for allergies, some antidepressants, and medications used for bladder control. They work by blocking a key neurotransmitter, acetylcholine, which the brain depends on for attention and memory. In younger people, the impact may be modest, but in older adults, the effect is far more noticeable. Studies consistently show that a higher anticholinergic burden is linked with confusion, difficulty focusing, and memory lapses. That is why clinicians often reference the Beers criteria, a guideline designed to highlight which medications are riskier for seniors, and they encourage patients to ask questions about their own anticholinergic load. The third group is opioids and other strong pain medications. These drugs alter the brain's perception of pain, but at the same time, they also diminish concentration and reaction time. An older adult taking these drugs regularly may drift into drowsiness during conversations, struggle with attention, or seem slower to recall details. These symptoms can be misread as progressive decline, even though they are reversible once doses are adjusted or alternative pain strategies are used. The reason these effects intensify with age isn't just about the medicine. It is about the body's changing ability to process what goes into it. Liver and kidney functions, which act as natural filters, slow down in later years. A standard dose that once wore off in 10 hours may circulate for much longer, stacking up day after day. The result is a steady cloudiness that families often mistake for permanent deterioration, when it is actually the byproduct of slower metabolism. What makes this more complicated is that symptoms accumulate gradually, making them easy to misattribute. A senior may have started on a low dose for sleep years ago without trouble, but as new medicines are added, perhaps an antihistamine for allergies or an opioid after an injury, the combined cognitive impact builds slowly. Even though each drug on its own may be reasonable, together they cross a threshold where alertness and memory falter. Clinicians often describe cases where memory loss appears dramatic, but improves quickly after medication adjustments. In fact, this scenario is common enough to be widely recognized in research and medical practice. Typical situations involve older adults who repeat themselves in conversation, forget familiar names, or show morning confusion. Families often assume early dementia and come in worried. Careful medication reviews, sometimes called brown bag reviews, reveal overlapping sedatives, anticholinergics, or pain medications. Once doses are reduced, timed differently, or switched to safer options, the fog clears within weeks. This shift illustrates how easily memory symptoms can be misinterpreted if the medication factor is overlooked. Understanding these categories of drugs doesn't mean they should never be used. Many provide important benefits that improve quality of life. But it does mean that constant reevaluation is necessary. if memory issues surface suddenly, asking about medications is a practical first line of defense. Patients and families who know which drug classes affect cognition are better equipped to ask the right questions. A simple prompt such as, "Could any of these medicines contribute to forgetfulness?" can help redirect both doctors and caregivers toward possible answers. Another practical point is timing. Even small changes in when a drug is taken can influence alertness. A sleep medication used late in the evening may carry over into the next morning, while the same dose taken slightly earlier could wear off sooner. Similarly, daytime use of antihistamines increases the chance of haze during hours when concentration is most needed. Recognizing how schedule interacts with side effects can sometimes solve problems without having to stop a medicine altogether. It's also important to remember that medication side effects don't always mimic dementia in obvious ways. Some people report being unable to follow a conversation, not because they can't remember words, but because they can't keep attention focused long enough to process them. Others describe lapses in judgment, like forgetting to turn off the stove or missing bill payments despite long-standing habits of reliability. These changes often reflect slowed brain processing rather than the irreversible neuron damage of true dementia. Spotting the difference relies on carefully looking at when symptoms began and how they connect to the use of medications. This is why healthcare providers warn against evaluating memory loss in isolation. A new symptom is not always the start of a chronic disease. Sometimes it is the body signaling that the current load of medications is too heavy for the brain to handle smoothly. The good news is that, in these cases, recovery is often possible. Adjustments may bring back alertness, restore confidence, and offer reassurance that memory trouble does not always signal decline. Families who learn about these three buckets of risk drugs, sedatives, anticholinergics, and strong pain medications, start to see patterns that were hidden before. That awareness reduces unnecessary panic and supports clearer communication with physicians. Even asking a doctor if a particular drug is on the Beers list or contributing to anticholinergic burden opens the door to safer prescribing choices. Ultimately, the important message here is that prescription drugs can be powerful influences on brain health, both helpful and harmful. The line between relief and risk becomes thinner with age, but being informed shifts control back toward patients and families. Instead of assuming the worst when memory falters, you gain a practical lens to interpret what is happening. Of course, medications are not the only substances that affect how the brain functions in later years. Another influence comes not from a prescription, but from daily habits around relaxation and leisure. And while it often begins as something simple shared with friends or family, its long-term impact on brain health can be just as significant. Alcohol, friend at parties, foe in the brain. Alcohol carries a unique role in discussions of memory and aging. It is often seen as a casual companion, social at gatherings, soothing in routines, yet it can act as an unrecognized driver of confusion and memory loss in later life. While many adults think only heavy drinkers face risk, the evidence shows otherwise, according to the National Institute on Alcohol Abuse and Alcoholism. Over half of people aged 65 and older reported drinking alcohol in the past year. For a younger body, a drink may burn off quickly, but for older adults, slower metabolism and body composition changes make even modest drinking more potent. What looks like just one may hit the brain as double or more, carrying consequences that build silently over time. The growing prevalence of alcohol use among older adults reflects more than habit. Retirement, shifting routines, and widespread cultural acceptance of alcohol as a relaxation tool all contribute to why so many continue to drink well into later life. Some describe it as a social bond, wine with friends, a toast at dinner, or part of group traditions. For others, it becomes a solitary nightly ritual, something that feels like a comfort or reward at the end of the day. Regardless of the reason, Regular alcohol consumption in later life brings cognitive and neurological risks that families often misinterpret as age-related decline. Recognizing the effects matters, especially when early warning signs look nearly identical to progressive dementia. One of the best documented effects of long-term alcohol use is structural change in the brain. Older adults already face normal, age-related brain volume loss, but alcohol exposure can accelerate shrinkage in areas tied to memory and problem-solving. Families often observe slower recall, weaker attention, or blunted decision-making, and assume these are natural signs of Alzheimer's or vascular dementia. In reality, the changes often trace back to alcohol. Importantly, studies on alcohol-related brain disorders, sometimes referred to as ARBD, show that symptoms are not always permanent. Many people who stop drinking experience partial or even full recovery in cognitive function. That finding underscores an essential point. Alcohol-related memory issues may not be a fixed sentence, but a problem that improves when intake stops. Alcohol's impact goes beyond brain structure and extends to nutrition, particularly vitamin absorption. One critical nutrient affected is thiamine, vitamin B1, which supports normal nerve and brain cell function. Without enough thiamine, confusion, disorientation, and profound forgetfulness may occur. In extreme cases, chronic deficiency tied to alcohol use can result in serious syndromes that mimic severe dementia. The hopeful side is that with supplementation and reduced drinking, many symptoms improve. Yet, the obstacle is recognition. Families often assume these alarming changes represent irreversible decline rather than preventable nutritional disruption. Cerebrovascular health is another piece of the puzzle. Alcohol raises blood pressure, disrupts circulation, and increases stroke risk.